Welcome to FUNC YOU UP, the podcast that gives you the best of functional medicine, nutrition, and wellness in 8 minutes or less.
Hello, everyone. Welcome back to FUNC YOU UP. This is Michelle Miller, clinical nutritionist.
And this is Diana Orchant, functional medicine registered dietitian-to.
I'm so excited for today's episode. We have with us one of our coworkers, Dr. Sarah Rodriguez, who is the head physical therapist at our office in downtown Brooklyn, Physio Logic. And we're going to talk about this idea about the vestibular system and really vestibular rehab and kind of what that means, who it's best for. And, you know, tune in, because as science, as sciencey and nerdy as this sounds, this is going to change someone's life that I guarantee you. So, Sarah, thank you so much for joining us. I really appreciate it. Start us out with just, absolutely.
Thanks for having me. I'm so excited to do this. I know you guys have been doing this for a little while, so I'm very pumped to be here.
Well, start us out with some of the basics, just for someone who's never even heard the word vestibular system. What does this mean, and what are kind of some ground pieces of information we should know?
Sure. I feel like I can't talk about the vestibular system without first talking about equilibrium. Okay, so equilibrium is just our sense of balance and where we are in space and our understanding of that. And when we think about equilibrium, I'm very visual, so I always think of it like a tripod. There are three main things that affect our sense of equilibrium. The first is actually vision. So if you have ever stood on one leg and closed your eyes, you can understand how much more challenging that is than just standing on one leg with your eyes open, right? It makes a huge, huge difference. Vision is such a big thing when it comes to equilibrium. So that's the first thing. Second thing is something called your somatosensory system. So that's your sense of balance. It's your sense of touch and proprioception. It's kind of how your sensations perceive the environment. And then the last thing, which is probably the most important, is the vestibular system. So the vestibular system is basically like an internal reference point for us. It basically allows us to understand where we are in space at any given moment, despite how we're moving. So a lot of it depends on our head positioning. So it depends on the direction of our head movements, the acceleration of our head movements. And so the best way to think about it is examples, because I know this can be this topic itself can seem intimidating because it is a little bit complicated when it comes to anatomy references and things like that. So one or two really good ways to think of it is first, like say you're walking on the sidewalk, right? And you happen to see like a beautiful bird walking by or something, I don't know, and you're in a rush to get somewhere, but you want to take a look at it and you want to follow it as it's flying away, right? So you being able to do that, being able to fix your gaze on the bird as it's moving while you're walking and turning your head, those three things combined make up that tripod, right? It's your balance, it's your somatosensory system, and then your ability to focus on it. All those things make up your equilibrium, and a lot of that is due to the vestibular system. Another one is, and this is huge because a lot of patients who come in have difficulty with this, is something as simple as walking down the aisles of a grocery store. So turning their head left and right to look at food items while walking down the aisle can, that seems so basic, right?
Like we don't granted, right?
Totally take it for granted, but these are the types of things that we work on with patients. It's these like very simple everyday things that are affected from the vestibular system.
So how do you know, I guess, when you see patients come in, kind of what are the signs, symptoms, how does all these this imbalance kind of manifest?
Yes. Okay. So some telltale signs. The most common is something called vertigo. So people throw that word around all the time. It's actually different than dizziness. Vertigo is the sensation that the world around you is spinning, whereas dizziness is something more internal.
Yes.
So vertigo is probably one of the most common symptoms. The thing that you have to understand about vestibular issues and disorders is that there's not just one kind. There is like a wide range of them too. So you might fall into one category, but not show signs of any of the other symptoms. But that's the most common. The next is just this feeling of unsteadiness, so loss of balance or instability. Oftentimes people will come in and they will have fallen a bunch of times, or they're really fearful of falling because they just feel so unsteady. The next one is just general motion sensitivity. So, you know, again, just walking on the street, like say if they encounter a crowded area, getting freaked out by all the movement happening around them because they get really thrown off. There's another one that is, it's kind of bizarre, and it is more for people who can actually see the person themselves cannot actually see it, but it's something called nystagmus. It's this involuntary repetitive movement of the eyes. It looks a little bit freaky. Like when you're looking at a person and they're experiencing this vertigo, their eyes end up like ticking in a certain direction repetitively and involuntarily. It's quite bizarre actually when you first see it, but that's another potential symptom. Sometimes hearing loss too, or like hearing issues can be associated with it because the vestibular organ is located in the inner ear. So it's not something you could see. I had a patient once ask me if they could see it if they looked inside their ear, but unfortunately that's not the case. It's located, it's deep inside, it's tiny, it's microscopic. It's right next to the auditory canal. And so if the organ gets inflamed or irritated in any way, it can have immediate effects on the neighboring auditory canal.
Wow. So
yeah. It's
I mean,
crazy. I know.
And we think about how often, you know, you do all of these things that you're talking about and what life would be like if you had to think every time you got on an escalator, every time you went to got on the subway, went to a baseball game or a concert or something.
Sure.
And it's fascinating. How did you get into this?
That is a great question. So I will start by saying that at first I had no interest in this. I was interested in orthopedics all the way. And in grad school, they offered vestibular rehab as an elective that you could take for a few weeks. And I thought to myself, sure, why not? I took it. I found it to be relatively interesting, but didn't think much of it. Cut to a few years later, when my mother actually started to experience some vestibular symptoms. It got so bad that she couldn't go to work for like 1 to 2 weeks.
Wow.
She couldn't drive. She was basically homebound because she was terrified of leaving her house because she was fearful of falling. The world around her was spinning nonstop and she had no idea what to do. And so it kind of killed me a little bit because I sort of knew about it, but I couldn't treat it directly because I didn't fully understand it. And so that really stuck with me. She went to see a couple of doctors. The first few gave her, some said to just give it time. Others gave her some medications. She's really sensitive to medications. And so that completely threw her for a loop because it caused other side effects. And then finally, she saw somebody who prescribed these basic head positioning exercises. You basically just put your head in these different positions. Again, it looks very bizarre, but it works. And within 1 to 2 treatments, she was fine. And so, with that being said, it killed me because I knew, I knew I could have helped, but I didn't know how. And so after that, and after working with a lot of people who had mentioned to me in passing that was something that they had experienced or something they were currently experiencing but didn't know how to fix it, that it was just something that I needed to do for everybody around me. I mean, so many people deal with this, and I think either people don't talk about it, there's just not much communication about it. So yeah, it's been great. Again, it's a complex system, but when you rehab it and you understand the ideas behind it, it can really help people's quality of lives. So that's how I got into it.
That's amazing. So you talk about kind of these, that, you know, your mom and other people that you've worked with have tried these medications and they don't always work. And then they
Sure.
find head positions and different PT exercises. I guess, can you just talk a little bit about like the more conventional approach versus kind of what you would do?
We learn basic things with regards to vestibular rehab, but what is so huge and what really makes a difference with this patient population too is really understanding the rest of their lives. So for me especially, everybody's completely different. I treat everybody as an individual. I spend a lot of time, especially during that first visit, just talking to them because it's so important. So understanding really, of course, like the symptoms and kind of what's going on, but then also really understanding what's triggering it, but also learning about their day-to-day lifestyle, you know, because part of this too is we're learning that things like stress, things like lack of sleep, coffee intake. My mother, unfortunately, loves coffee and she can no longer drink it, but it helps her. She hasn't experienced a bout since then. So it's really like getting into people's lives and understanding where each person is coming from and addressing those things through rehab too. It's not just a physical thing. This is very much a mental and emotional thing. I actually haven't really spent much time talking about like concussion, but that can also cause a lot of like mental fatigue. You know, it can be very emotional too because your brain is literally tired. It's gone through head trauma. It's gone through a lot. And so, you know, we try to every day, there's always like a cognitive component to our rehab too, where we're working on like memorization skills, or, you know, I try to find ways to reincorporate, you know, things that have to do with their home life. So I'll ask them about things they did last week, or I'll ask them to like read their favorite book to try to integrate certain systems together, things like that. So I'm digressing, but yeah, it's just so important to really understand where people are coming from and how they live and what other potential factors could be contributing to it.
I think what I worry about with things like this is that, you know, I had concussion. I had, you know, a couple months of these like post-concussion symptoms. I really understood the power. Thankfully, I was able to work with someone who could quickly zone in on the vestibular system and help with that rehab process. But I think what is so just upsetting about this area of work is that there is such a lack of awareness from provider standpoints and from the patient standpoint, and you really feel lost as a patient because you look the same and you can kind of do a lot of things the same.
Sure.
And then you go to the best neurologist or the best doctor and you don't get this.
Yes. So I will tell you, about 2 years ago, I gave a presentation to a large room filled with doctors. And I was shocked because a lot of them hadn't even heard about vestibular rehab. They came, I mean, it was a really popular talk, which was great for me, but most of them just had no idea. Like they were genuinely just curious about what it entailed and like, what do we do? And like, how do we send patients? How do they send patients to us? And which patients do they send to us? There was just, it was really interesting. I think that was a big moment for me because I thought to myself, like, wow, like we're a healthcare community, you know, in this huge, like vast, when you think that we're all so well informed, there's just that lack of communication, which is actually why I love the Physio Logic model, the integrative model where we all try to really work together. And so that was just really eye-opening. And then, I mean, I can't tell you how many times patients will come in to see me and they'll say that they've gone to several doctors, none of whom have recommended vestibular rehab, when in fact, with those same people, I will treat them 1 to 2 times and they'll be just fine. You know, and it drives me crazy because it's cost effective. It changes quality of life much quicker. So it's just beyond me. And so I think, you know, things like this are important, is just creating awareness that this exists and is here to help people, because it really can affect everything about your daily lifestyle. It can be really, really debilitating.
How common is this?
It's very common. It is much more prevalent in the older population for sure. It is, according to a statistic from a year or two ago, it is the number one dizziness is the number one most common medical complaint in patients over the age of 70. So it might not be their main complaint, but they will mention it as part of what they're experiencing. So, and again, in that same time period, again, I read this about like a year or two ago, so it's probably increased since then, but 8 million visits were related to dizziness, vertigo, vestibular type issues. So it's out there. And that's not even including people who've had head trauma or concussions. And I'm sure a lot of it's being underreported, you know, so it's there. And it's not just older people too, it's younger people as well. Some medications can cause like ototoxicity, which can reduce the receptors and can also mess with that sense. So like medications, like different medications can cause vestibular side effects too.
So you've completely enlightened us, and I can imagine our listeners are feeling the same way. So what can they expect, or what can anyone expect if they did come in to see you and actually did this type of vestibular therapy? Yeah,
so vestibular therapy is very funny, actually. It's not like your conventional physical therapy treatment where you're working on like strengthening your knee or your shoulder or anything like that. It is, I feel like I keep using this word throughout this, but it's a little bit bizarre. When you first come in, like I said, during the first visit, we spend a lot of time, again, just talking about everything, like really understanding what is going on and getting a sense of that. I will always take a look at balance. I will always take a look at your eye movements and what we call ocular motility. So like trying to get a good understanding of the quality of your eye movement. I'll have people do different head positioning movements, again, depending on their symptoms, but it's a bunch of balance, eye positioning, head positioning movements just to see how people are able to integrate all the different systems. And then based off of that, we then, a lot of times vestibular rehab is funky. Like we're the people who, like when you walk into the clinic, you see them shaking their heads like crazy, or they're doing these like very strange, like they're balancing on something, they're looking one way and then they're reaching for something else. Like the point is that we're trying to repeat the symptoms so that their central nervous system can basically reconfigure and understand what they're trying to do. I like to equate it to figure skaters because I used to be obsessed with figure skating and like watching it on TV, but like think about it, those figure skaters, like they didn't just wake up one day and were able to twirl without any sort of dizziness. When I turn one time, when I'm like going up a stairwell, I'm immediately dizzy. You know what I mean? Like they have trained their bodies to do that, and their vestibular organ and their central nervous system, all of that has gotten used to that. And so we will often work on individual, like I'll work on balance, like I said. We often play with like fun cards. I like to tailor it to people, and I like to have it be fun. So if people are having difficulty like stabilizing their gaze on things, I'll have them like next time, like I'll have them bring in a book that they really enjoy, or like read an email that they need to read to me, like things that pertain to them, you know. And then maybe as home exercises, I'll have them again do something that actually matters to them. Like I won't have them just like look at a dot and move their head around. Like I'll have them do something that is more appropriate for them.
I think what blows my mind is that, just from my personal experience, was like when you're going through this, it really feels like life as you know it is over, and it's very upsetting. And we were talking about before we started recording, like the associated side effects of having these symptoms, right? Like you start to feel crazy, you can't function a certain way, put stress on your family. And then you go into the right provider and you start doing some of these like exercises. You're like, what the heck did I get myself into? But the crazy thing is, like, give it a couple of sessions and your life is going to change. And that is the mind-blowing part of it.
Exactly. I mean, I think my favorite stories are, like, I've been treating for almost 9 years now, and my favorite stories are those people who come in so debilitated. Like, these are the people who haven't left their homes in weeks because they're scared to go outside because they think they'll fall, you know, understandably so. It's really scary to feel that way. But those are the best. When they come in, they're incredibly fearful. They are very reluctant to try it because they're like, what on earth is this? And what
How could this possibly work?
You know what I mean? Right.
Mm-hmm.
A lot of them are like freaked out by the idea because, you know, I try to set the expectation that a lot of what we do actually does trigger the symptoms. Unfortunately, that's a huge thing that I actually try to educate them about in the beginning. But it's funny, like, they will be so reluctant at first, and then it's just really amazing to see the progression to the point where, like, you know, when they're discharged, they're out and about and hanging out with friends and, you know, no qualms about anything. And so it's so great. And it is, again, it's a complicated, somewhat messy system at times, but when you understand it and when you can really use it to help patients feel better, it's incredible what it can do, not only physically, but mentally, emotionally. I mean, we've been talking this whole time about how it is very much mental too. It can be so debilitating, right? Because it really does relate to everyday life. Anything you do in life, any movement that you do in life requires that sense of equilibrium. So yeah, it's great to see changes not only in physical function, but just quality of life. It's the best. It's like why I do what I do, you know?
Amazing. So if we do have individuals that want to come see you, you're in the office now, and I heard you have I also heard you have a webinar coming up.
Yes, word on the street. I have a webinar coming up. It is on Thursday, June 25th at 12 o'clock. And so that will just be kind of an extension of this. It'll give viewers a chance to ask questions related to this, because again, I know there are so many conditions and things that can be confusing about this, but it will also give people a better understanding. I know I kind of brushed over it today, but it'll give people a better understanding of kind of the anatomy behind the vestibular system, and again, kind of what visits entail. Like, I think a lot of times I feel like the word vestibular is just intimidating in and of itself, right? Like, would you agree? It sounds scary for some reason. And so I think just breaking that down for people so that they have a better understanding of what it is and how it can really help people. Just encouraging people to try this route if you have been experiencing these symptoms and you just don't know what else to do. Like, this is very much a viable option.
There's nothing to lose.
I have nothing to lose, only win, only gains here. So, yeah. And if anything too, again, we're working on balance too, you know, like we're working on like all these other things. So despite all of this, it's so important to kind of keep this particular organ like nice and strong, I guess.
Well, thank you so much, Dr. Sarah. This has been you're such a wealth of knowledge. And again, I think it's almost too good to be true for some people. And I just urge anyone who is dealing with these symptoms or knows anyone that is dealing with these symptoms, please pass on this episode. We always record the webinars that we're doing at Physio Logic, so you can always catch those on our Virtual Logic page. But I mean, I just applaud you. You know, you had already had a great physical therapy, you know, career going, and you dove into something that you didn't need to. And I mean, the amount of lives you're literally changing is unbelievable. So thank you for getting the word out. Thank you for being so passionate about this field. And thank you for your time today. We appreciate it.
Thank you so much for having me. It's been a pleasure. It's been a lot of fun.
Thanks, Sarah. So if anybody out there has any questions about this, please reach out to us. You can reach us on our Instagram at PhysiologicNYC or via email at funkyouup@physiologicnyc.com.
We'll see you next time.
You've been listening to Funk You Up. Be sure to like, review, and subscribe for more daily tips on living well.